Welcome. Thanks for taking your time to attend this session. We have a very experienced team here to talk to us about innovations for immunization, solarization, freeze prevention, and life cycle assessments. These are all very, apart from freeze prevention, carriers which have been in the field for a while. Solarization and life cycle assessments are kind of experimental procedures which are currently being field tested. So I think this session is very important for us to be able to see what has been done and where we are going. Just to introduce the panel, we have Mr. Yauba. I will not read his long CV now. Who will talk to us about, what's that? Evaluation of Cameroon's experience in implementation of cool water parks. And then we have Mr. Sandeep, who will talk about freeze prevention cool boxes. That will be followed by Steve. Steve will start first, but Steve will be addressing climate change in immunization programs. Without much ado, I think we have already wasted a few minutes. Steve, can you just go ahead? So, Steve, you have 12 minutes, and there's a timer there. So we.
All right, great. Thank you. So I'm going to start with life cycle assessment and then kind of have a separate, smaller part at the end on solarization. And I acknowledge I have way more content than the time that I've been given, which is just fine, but I'll have to go quickly through some things. So I think life cycle assessment is probably new to a lot of people in this audience. So there is an ISO standard for it, and kind of the point of it is looking at a system. It kind of came from engineering and industrial systems, so it usually focused traditionally on a product system and manufacturing it through the entire life cycle. But it gets used to answer a lot more complex questions about how we make a product more environmentally friendly, or should I, as a consumer, use a paper bag or a plastic bag? And you want to look at, you mine these resources, you build capital equipment, you tool up if you're molding things, right? You've got all these things that go in, and each of them has some environmental impact. And so you have to total that all up. And so you make some model that totals that all up across the entire life cycle. And then you try to answer these questions that seem simple, but really they're very complicated when we try to talk about environmental systems. For us, I do want to start with, because a couple of people have asked me already, like, this isn't going to compromise health, right? Like, we have a remit to immunize people and save lives. And this is not intended as like environment, considerations. Carbon impact isn't coming above that, that health impact. But if there are places where maybe there are compromises to be made in product design or in specifications, things that can increase or decrease our emissions, maybe there are places that we can do that without compromising on health. So just calling out, this is just a clipped slide from the UNICEF analysis on carbon emissions for the entire immunization system. That's a huge scope, and they've done a great job of setting out kind of this initial thing to jump off from for where the emissions coming from. And we're only focusing on greenhouse gas emissions here. We're not talking about toxicity, ecotoxicity, human health, like kind of at a more locational degree. This is just about carbon emissions. And so you can see there they have these percentages based on the modeling that they did. It wasn't a full life cycle, but it is carbon emissions estimations for kind of what's happening within the immunization system. And there's some interesting things that are unexpected that come out of this. I will say that each separate piece is modeled very simply because they were looking at a huge system. And so you can question the numbers, but there's some directionality there of like, there are some large emissions there that, you know, they maybe even can go down by a factor of 2 based on what data you're using, but they're still large. So jumping down into like, how might we use this in our systems? So there's this question or this idea that local manufacture is good environmentally. So I think there's many other reasons why local manufacture is good. No, not questioning those or going into that right now. And maybe that trade-off doesn't need to be made. But in terms of what does local manufacture do environmentally, there's this assumption that you manufacture locally, you're not transporting as far, so there's going to be fewer emissions, right? Which maybe does play out and maybe doesn't. So looking at syringes right now, which is what we've started with, and I know most of us are cold chain folks, but the syringes do have an effect. That UNICEF analysis had them at a pretty large percentage of the total emissions of the immunization system. So looking at the life cycle of this, like where could we get improvements and what activities might that entail? Is it specs? Is it syringe design? Is it changing shipping, or is it this local manufacture? So we've started kind of a model that's pretty simple. I wouldn't call it a life cycle assessment. At this point, it's more carbon emissions estimation, similar to what UNICEF has done, and seeing what local manufacture does. And I would call out that in the UNICEF estimation, only 1.62% of the total emissions for the immunization system is from transporting syringes. So we're already looking at like a small percentage of the emissions. So when we talk about what local manufacture might do for decreasing emissions, maybe it's not the biggest target. So just calling out that we're using emissions factors here. I'm not going to get deep into it, but all those numbers. So in LCA, you're going to bring along all the emissions that come out, right? It's not just the greenhouse gases. For the calculations UNICEF was doing and for this analysis, we were using emissions factors, which give you like one number for polypropylene, right? And you say, I have this much polypropylene, this much plastic, and I use this one number and I just multiply it by the mass of plastic I'm using. So it's a very simplified calculation, but behind each of those emissions factors is usually a life cycle assessment, and there's good modeling behind those single numbers. So this is the scope we were looking at, right? Transport, 3 transport steps. One that gets left out often is like, so we have local manufacture and you say, well, then you only have to take the syringe from point A to point B in Africa, but you still have to get the raw materials from somewhere to Africa, right? So if you're getting your Chinese raw material and then manufacturing in Africa, might the environmental benefit just be manufacturing in China? Maybe, right? So I think ignoring that because of how procurement happens really does a disservice to where the emissions are actually coming. So just quickly, I put the raw materials in here. The red bar for raw materials is the emissions from the UNICEF analysis. Using the emissions factors that we were using, it's a little bit less because, again, they're coming from different sources. And you can see even just bringing in raw materials, nothing about production, nothing about energy for production, just the raw materials, they're a pretty outsized effect compared to transport. And then we have a few transport cases, which I'm not going to get into, but that's kind of the variability of if we're doing different cases of, you know, African manufacture and then a lot of overland transport. And I think what I want to call out on this slide is that you see that little infographic there, where if you're transporting by ship, you know, normalize that to 1, and then your train freight is pretty low emissions, but then you get a factor of 10 on for truck shipments, right? So if you're doing a lot of overland transport because you're trying to do local manufacture, you pretty quickly lose those gains environmentally or emissions wise. And then if you start air freighting things, which I think most people know, but just to call out and like drill it into your heads, if you're doing air freight, you just overwhelm all these other things usually, right? So when syringes get sent by air, because they need to get them there quickly, maybe because the vaccines came and we didn't know when they were coming, that just like overwhelms all of these other emissions decreases that we're talking about. So where we're heading with this, we kind of did that transportation analysis, and we have some outcomes from that it does matter, but you really need to take into account where the raw materials are, where the manufacturing is happening, how much overland transport you're adding because you're manufacturing somewhere else and you don't have good ocean routes getting there. And then we're working on actually a few full life cycle assessments of a few products. I guess they'd be gate to gate. They won't be cradle to grave, which is the LCA terminology. So that was very quick. I'm happy to talk about life cycle assessment a lot more with people, also in terms of cold chain equipment, which I know some of the cold chain manufacturers have taken on, even for RTMDs. And so I think there's a lot of energy around taking in environmental factors into account in procurement, in manufacture, in production. And I think there's a lot of space to work there. And then I'm going to jump into solar for these last few minutes. So I don't think many of us need to talk about the need for power at health centers, but there's some statistics there of low coverage of power across the African continent and many other places, and the effects from that are pretty huge when you're talking about the lowest level health centers, right, where most of what they're doing is maternal care and deliveries, and you don't have lights at night. Like that's the simplest thing, right? And so one thing that we've worked on with a number of people and manufacturers included is the EHC spec, the energy harvest control. So just a plug for this, that it exists if you're working in systems, ordering equipment, or like analyzing your cold chain. So there's SDD fridges, which are amazing, and they work, and they don't get dirty power from the grid, and they have huge thermal holdover. They're great. But they also come to these health centers that don't have any power. You've got staff that can't charge their phones. Often those staff are pulled from the communities that they live in, and they don't have good ways to communicate home. So there's all of this like knock-on effects of not having that power. And then you come in and you install a fridge and a solar panel, but the energy can only go to the fridge, and that doesn't feel good, right? Like that's not a great outcome necessarily. So energy harvest kind of deals with that effect and says, you've got this panel, there's extra power potentially because you have to have your fridge powered when it needs to be powered. But that graph on the right, without getting into detail, the yellow part, the area under those curves is how much power a fridge is using. This is an actual fridge. The blue part isn't like exactly the available power. It's based on solar emissions, so it might be a little more, a little less, but that's all unused potential power, right? That nobody can access. For good reason, because the batteries in the systems were issues historically, but energy harvest safely, and there's a spec for it in PQS, it safely pulls that energy off, makes sure the fridge is always prioritized, your vaccines are protected, and then that power can go out to other uses. Usually it's been a USB port. People are more familiar using USB ports, but it can be, there's been some development on 12-volt sockets. You can also do whole systems that are connected and wired in. You can do a lot with it. And so there's a way to use all of that power that's being left, that's not helping the healthcare worker do all these other things that they need to do, even if it's just personal things to help with their job satisfaction. So in the last minute, where a number of us at PATH have been wanting to go is, one, building off that, can you kind of use this siloed funding to help the health center as a whole and electrify? And then two, can we focus a little more with an equity perspective on solarization for working from the outside in, right? Like these health centers with zero power, maybe you're not getting the biggest health impact by electrifying there, but from an equity standpoint, like they need power to deliver at night effectively. They don't need to be using cell phone lights to do that. So just working from that outside in and trying to focus not necessarily on like cost benefits of solarizing portions of hospitals, but coming from the outside in and getting a little bit of power everywhere is kind of where we're hoping to go with this, and addressing kind of the long-term O&M costs of what happens when you put in a solar system. So that's my time.
Good, right on time. So there are 4 minutes for questions. Are there any questions for Stephen? Steve?
I applaud the efforts to look at the environmental impacts, and it looks like it's a bit of a longer-term project. It's not going to be done tomorrow. What can be done right away with the PQS catalog of information to guide people to use the most environmentally climate-friendly products?
Do you want me to answer that, or do you want part of that, Isaac?
Me?
Yeah.
No, it's for you.
Yeah. I mean, I think in terms of carbon emissions for production, I don't think there's a lot to do there. I think there needs to be a lot more analysis and paying attention to like the complexities of the system. I know, Steve, that you've been working on some of this, but we do have energy usage numbers in the PQS catalog, so there's some quick wins there of at least letting countries know how much power is going to be used, especially from AC fridges. Outside of that, I don't know if there's a lot of quick wins environmentally from what we have.
Yeah, so on top of that, Stephen, we'll be working next year with a specialist, an environmental specialist, who will look at our specifications and give some proposals on what we can do in the short and medium term. Yeah.
Thank you.
John?
Yes. Yeah. Good afternoon now. Yeah, not yet. Not yet. 1 minute. Yes, I'm Emilian from Churchill. I wanted to know, do you have data on how many health centers are using an energy harvesting system? The one who have already an SDD fridge and actually using an energy harvesting system to get at least light and fans. Just interesting to know if we have any numbers.
I don't have data. I know others at PATH, we do have some agreements with UNICEF, and so we have some procurement data, and we could cross-reference that with which fridges have EHC in them. I mean, an interesting thing, and part of the reason for the plug is that some health programs, ministries are purchasing fridges that have EHC, and because it's kind of low level, it's not being advertised well, and people don't know it. And so in some ways that's good because it'll come into the health center and people see a USB port and they'll plug in and they'll charge their phones and there will be benefits from that. But some concerted effort to get the word out about it would be good, because if the ministry doesn't know, they're not going to start to supply medical equipment, which would be, maybe another really good use to get low-powered medical equipment out there, and the healthcare worker is not going to bring in medical equipment. So.
Any other question for Steve? Okay, so maybe one last hand for Steve. Next is Yauba Saidu. Evaluation of Cameroon's experience in implementing cool water packs.
Thank you very much, Isaac. It's a pleasure to present the findings of our study that we conducted in Cameroon some times back. And also thank you for choosing to attend this session. So I have a little bit of a background. I think sometime in 2015, 2 months prior to the introduction of an injectable or inactivated polio vaccine in Cameroon, and unfortunate incidents happened. So a core room at central level became dysfunctional and destroyed over 500,000 doses of IPV. So that actually delayed the introduction of the vaccine, and also Gavi asked the country to pay to reimburse because they consider that as a negligence. So that incident actually prompted us to conduct a temperature monitoring study. I think very few countries have conducted that sort of study, and that actually involves monitoring the temperature as vaccines move from one storage point from central level right down to district level, facility level, and also outreach point. So when we did that, I think we had they monitored the vaccine movements or shipment across 48 different routes, and the findings were really astonishing. I think over 96% of shipments were exposed to temperatures above 8 degrees for extended periods of time, and about 83% of shipments were exposed to freezing temperatures. To freezing temperatures, and for some, I think the duration of exposure was really long, which would irreversibly damage the vaccine. So, leveraging on the findings of the assessment, we supported the government of Cameroon to revise its policy for transporting vaccines, and one of these was actually based on adopting the cool water pack strategy, which is a strategy that is recommended and is being used in other settings. And this was actually important because over 70% of vaccines that the country use are actually freeze sensitive. So vaccines like Rota, vaccines like IPV, PCV, and so on, and any exposure below certain temperatures like minus 0.5 for penta can irreversibly damage the vaccine. So the government actually updated its number and standard, and then included the concept of utilizing cold water packs to ship vaccine to from regional level to district level, and from district level to facilities, and also during the conduct of the conduct of audit sessions. So to evaluate the implementation of this policy, we actually had like two approach. First was to interview about 121 API staff, and then the second was to monitor the temperature of vaccines in cold boxes that have been prepared using cold water packs instead of ice packs. And we actually used one of the devices that was one of the devices manufactured by I think the manufacturer has a passive device. And when we did that, we had some sort of interesting findings. First of all, we have like the distribution of the people, different people who responded. The majority of them were actually at peripheral level. But again, just to mention, our questionnaire had about 10 questions looking at various aspects. So the first was, are you even aware that this policy exists? If this policy exists, what are like the procedures or the principles for conditioning ice packs, in short, transforming ice packs from ice packs to cold water packs? How do you like pack the box? How do you pack the vaccines, and so on? So we had a questionnaire that had about 10 questions, and we kind of considered someone to have sufficient knowledge if he scored 8 out of the 10 questions, and that is scoring of about of over 80%. And what we did is when we evaluated the staff, we found out that majority of them, in short, over just close to 70% of them were not aware of the policy, and neither were they aware about the different approaches of applying the policy, like how to prepare the cold water boxes and so on and so forth. So now this is just to show you at least some readings for some of the routes are essentially like 2 routes. So when we got the device, we actually extracted the data, and this is really what we found. So this is these are readings that were recorded on a single day, I think about 5 hours. And here you could see the exposure. In short, the shipment was not maintained within 2 to 8. Within 2 to 8 for the entire period of time, right? So almost about 35% of shipment actually experience exposure above 8 degrees. But on the contrary, just one shipment actually experienced freezing. So you could see here when the device was placed, the cold water packs in the box with the vaccines and the device, you could see a steep decline of the temperature to about minus 1, and this continued and then started rising sometime, which actually indicates that the cold water packs were not properly conditioned. So this is it. So in based on the findings, we could actually say that cold water packs are important and recommended in Cameroon for temperature management during vaccine transport, and we know the reason. And that despite the introduction of the policy like 3 years before the study, the efforts made to disseminate it, healthcare workers' knowledge and accuracy of implementation of the policy continue to be suboptimal, and this could be explained by gaps in temperature management recorded during this study, particularly when it comes to freezing, although very minimal. And again, we propose a set of interventions about about five of them. The first was conducting targeted trainings of healthcare workers on how to handle vaccines, how to implement the cool water packs policy, some sort of hands-on training to improve and harmonize the implementation of the policy, dissemination of the policy or standard operating procedures to implement the policy, and exploration of last mile delivery interventions, and also performance management and sustainability. So I think this brings me to the end of my presentation, and I thank you for your kind attention.
Thank you. Any questions? Can see Gilles. Who else? Okay. Mike here. Okay.
Thank you very much. I have a couple of questions, actually. The first one is, do you only use the cold water packs, or do you operate a mix where you have cold water packs and still as well, let's call it frozen ice packs in your system?
Okay, that take the question. So I have the habit of taking simple questions and referring difficult ones to my boss Ashvin, who is there. So this one I think I can attempt. So the policy was enacted, I think, in 2019, and in short, the idea was actually to migrate from ice packs to cold water packs. But as we stand, we do not have like a clear visibility on how many facilities are actually implementing the policy. So the data that I presented to you here was actually based on a selection of health facilities that we knew that were actually implementing that were actually or supposedly implementing the policy. And this was actually tied to the deployment of cold chain equipment that were acquired using the via the Gavi cold chain optimization, equipment optimization platform. So for now, we cannot tell with certainty how many facilities are actually implementing this policy and how many are actually currently continuing with the practice of using ice packs. And again, it's important to add this because at that point in time, we were actually like very interested in protecting vaccines, getting our facilities to implement the cold water packs. But unfortunately, we had this COVID pandemic with the need for ultra cold chain equipment, and that actually affected a lot of behaviors among cold chain workers, and we've actually found it very difficult to control that behavior.
You hear me? Okay. Because using cold water packs, it reduces the autonomy of your vaccine carriers and vaccine boxes, right? Because you don't have the ice. So do you not run then, on the other hand side, into too high temperatures when you come to the end of the autonomy of the boxes? Because I imagine a box which has 100 hours of autonomy with ice will end up with maybe 30 or 40 hours when running on water packs only. Did that not create an issue?
No, we didn't actually observe the issue because I think for us, most of the facilities are located within, as you could see on the graph, about 5 hours, 5 hours away from the collection point, right? So if for the facilities, they will collect vaccines from the districts, right? And for many of them, they are just like within 5 hours. And most of the boxes most of the boxes that we use do have are actually capable of maintaining the temperature with cold water bags for extended period of time, like even up to about 72 hours. So we didn't observe we didn't observe like much variations. So that's why we found in the shipment that just about 35% of shipments experience temperatures above 8 degrees. But this was actually linked to the preparation of the conditioning of the ice packs.
Where do you produce the cold water packs? Do you have specific fridges or specific freezers?
So we have freezers at district level, right? We do not have freezers at facility level. And the main reason why we have freezers at the district level was really to support in the production of ice packs, right? And so when facilities go to the district to collect vaccines, they only go with their cold boxes, with their vaccine carriers. And once they're in the district, they get the ice packs from the freezers at the district level, and then condition them and transform them into cold water packs, put them in the boxes, and then transport them. I think that was like a strategic decision which actually was implemented thanks to funding from Gavi via the CCOP platform. Because for all facilities, we did ensure that at least where there is electricity, we ensure that facilities have freezers like Iceland refrigerators. But at the same time, in districts without electricity, we did preview the allocation of freezers that could be powered by electricity, particularly those from domestic that have like dual compartments. But at facility level, there are just no no freezers. So that was just to eliminate the possibility of exposing vaccines to freezing temperatures at facility level.
Because then when you produce the water packs in freezers, the problem remains of the conditioning, right? The people have to, if they use it too early, the freezing risk remains there, right?
Yeah. So that is why we develop an SOP for that. That's why we develop an SOP outlining, looking at the different, in short, how you have to do that, for how long do you have to keep them on the open air and so on.
Thank you.
Great.
Yes, one more question before we.
There's one question here. Okay, there's.
Thank you very much for the presentation. I think it brings out, I mean, it's the first time I'm seeing this kind of study, I think, on cool water packs. I just wanted to understand a little bit more on how you measure the knowledge of the health workers. Because when you say, for example, 31% had sufficient knowledge and then 53% felt that they were sufficiently informed, I'm finding it difficult to understand the measurement. Maybe if you could explain a little bit more, because if people feel like, would you be satisfied that the 53% really understood, like, for example, I mean, they had that knowledge, so maybe just a little bit of clarification or elaboration on that.
So we had a questionnaire that had 10 questions. And the questions were essentially yes or no. Do you know that this policy exists? How do you prepare ice packs or choose the most appropriate response and so on? So we did define as benchmark for sufficient knowledge people who score people who scored above 8, and we transform that into percentages. So we consider someone with a score of about 80, over 80%, as having sufficient knowledge, and the other one, the people with below 80% having insufficient knowledge. So that was like a broadly arbitrary, not informed by any research or so. So it was just like a choice that we did make at our level in collaboration with the API and other partners. So the idea was really to just check whether they are aware that this policy exists and whether they know how to implement it.
Let's give one last applause. Next is Sandeep, please.
Hi. Good afternoon, everyone. I am Dr. Sandeep Kumar, working with PATH and based at PATH New Delhi office, and I'll be presenting on freeze preventive cold box evaluation, primarily from the field perspective. This study was done in Nepal. My another colleague from Nepal, Dr. Surendra, was also about to present with me, but he could not travel. So This one second. The green one, okay. Okay. As we all know, I think I'll not go much in detail, but because we all know that the vaccine sensitivities, the freeze sensitivity, the heat sensitivity, and which all vaccines generally are exposed to freezing temperatures when we talk about the T series vaccines and other vaccines. So most of the vaccines which are being transported during the routine immunization are primarily the freeze sensitive vaccines, and we know that the freezing happens either due to primarily when we say that there are examples of global practices that put the vaccine at freezing, either vaccines are kept in direct contact with the ice packs or on the ice blocks, or primarily when there is in frozen ice blocks, or other when during transportation, the ice packs come in contact with the vaccines and their vaccine ice packs are not being frozen on that. So in that study, like we have, before going to this, for example, the freeze preventive products, when products were launched, as in the morning also we have heard that the WHO made a change criteria whenever a new technology or a device is being used or being approved, there has been a change in terms of the conditionally pre-qualification when there is a lab results from the WHO PQS approved lab, and also a field evaluation that also needs to be done. And we did field evaluations for freeze preventive vaccine carriers as well as also for the cold boxes on that. So this slide, primarily in PATH Seattle, we have a shop, lab, and led by Stephen. The risk of freezing at plus 15 ambient degree temperatures for the standard cold boxes with the frozen ice packs. This was done primarily with the worst case scenario. So one of the standard cold boxes was tested with the minimum, for the minimum MRT test, minimum rated ambient temperature, as per the WHO PQS standards protocol, with the ice packs at 25 degree Celsius for a worst case scenario. So you can see that the temperature dropped below 0 degree, and the standard cold box maintained temperature below 0 degree for multiple hours with a minimal test load. So this was a case when you can see that there was no ice pack conditioning being done, so primarily to test the worst case scenario on that. So when we talk about problems, when we talk about challenges, there is always a solution, and with the development of freeze preventive technology came the freeze preventive vaccine carriers. So there was a solution. So if we talk about the freeze preventive cold boxes, so this is the first, one of the first which Left Trade manufacturing company based at China is the first, one of the first freeze preventive cold box which got WHO PQS pre-qualification in 2021. And there are few specifications or the technical criteria. One is that the first is that what is the temperature range? If, as you know, for the most of the freeze preventive products, the temperature is 0 to 10 degree. And the temperature in vaccine storage compartment must remain above 0 degree and below 10 degree with an accuracy of plus minus 5 degree in an ambient temperature of 15 to 43. That is also as per the WHO PQS guidelines. There has been a different range. For the long range freeze preventive cold boxes, that's up to 96 hours, and for short range is 48 hours on that. So just a brief on, if you can look into this is a picture of the Left Trade cold boxes, and you might have seen at the manufacturer's marketplace also. So this is the first PQS pre-qualified, and it uses CFC-free polyurethane as the insulating liner and high-density polyethylene as the external material. These are the weight specifications. The storage volume is around 15 liters, and the empty weight is 24 kgs, and when it is fully loaded, it's around 49 kgs freeze preventive cold box on that. We did this, as this was the first freeze preventive cold box, so PATH, in collaboration with a medical school, a medical college, BP Koirala Institute of Health Sciences in Nepal, and along with Ministry of Health, we did a freeze preventive pilot in two districts of Nepal. The countries were selected primarily because of the interest and commitment by the Ministry of Health and the local partners. Variety of climatic and geographical conditions, because both plain and the hilly terrains were also selected. Also presence of PATH staff in India and global headquarters Seattle, so that is to monitor and conduct the study in Nepal on that. So both the hilly and plain district selection sites were also being selected. And secondly, PATH has also worked very closely with Nepal Ministry of Health as well as the BP Koirala Institute of Health Sciences for the freeze preventive of vaccine carriers evaluation. So we decided to go ahead with the same institution for freeze preventive cold boxes also. the objectives of the freeze preventive evaluation, when I think we talk about the evaluation, there's primarily three main objectives which we talked about: the performance, acceptability, and the health systems fit for, or the costing we talk about. The first, when we talk about the performance, it's mainly perform according to WHO PQS standards for the freeze preventive cold boxes. Acceptability, that are acceptable to end users when compared to the standard cold boxes, so the qualitative assessment was being done. And health systems fit well within the existing health systems, including cost considerations. We designed the study because generally as WHO PQS protocol needs to be followed. So we designed the study as per the available WHO PQS protocol guidelines. We divided the project into two phases. The phase one was the dry run. No vaccines were being used, only the dummy where cold boxes were carried and transported to during the transportation. And then the FPCVs were loaded with a dummy test load to simulate real vaccines. And phase two was the actual vaccines. There was a gap in between phase one and phase two. The temperature data, in the next slides, I'll show that we monitored the temperature data with log tags and other devices. And that data was reviewed by the Nepal Ministry of Health, and then they gave an approval for the phase two. Before the project approval, all the ethical committee approvals were also received from the local ethical institution committees and the Nepal Health Research Council also. The temperature data, just before that, the temperature data, as I was saying, that we collected from the temperature data from the standard cold boxes. We collected temperature data from the freeze preventive cold boxes also. For each freeze preventive cold box, there were two log tags which were used internally, one log tag top and log tag bottom, and one log tag was also tied outside to capture the ambient temperatures. Another is a parcel device. As you have also heard that we also use a parcel device because it captured light, temperature, and other humidity indicators. So that was also one internal parcel device also being used. And the third, we also collected temperature data from the freezer, and along with both devices with log tag and parcel were also used for the freezer data, just to check the correlation between whether the ice packs were really frozen or really conditioned at that stage during the using or not. This is just an example, this slide, which you can see that if you look at the temperature data, if this is a standard cold box, if you can see that if the temperature going below 0 degree temperature, the time to cool down for the standard cold box is very faster as compared to the freeze preventive cold boxes. But the temperature below 0 degree, you can see for the 2 hours, it has been a freezing temperatures, we can see that. But as compared to the freeze preventive cold boxes, the freezing temperatures were that it takes a time to cool down. If you can see the blue line, it takes a time to cool down, but there was no instances of the freezing happened during any time of the, even the field evaluations or also during the dry run also on that. This is a very important slide when we talk about the freezing temperature during transportation. When vaccine freezing happens, what happens is the freezing below 0 degree, it goes unnoticed. And generally when it is advised that as per the policy that needs to do shake test, but that it's entirely missed and it's not done at the facility level, or sometimes even the district health facility is also not being equipped to do the shake test. Whereas for the heat markers or heat exposure, we can say that there is a VVM, so we can rely on the VVM, the vaccine vial monitors, to understand that. So, which is generally, as we say, shake test or it's not being used. So the freeze preventive cold boxes really help during the transportation on that. This is a summary of the key data points from the phase 1 and the phase 2, which I said that phase 1, which was a dry run, and the phase 2, which was more of the actual uses. Both the temperatures data collection was done for almost 3 months. The phase 1 was almost for 3 months because, as you know, when the district, these cold boxes were used primarily at the district level, which is a county level, so that in transportation from the higher, the regional or the district cold chain stores to the primary health centers, once in a month it was used. So we had to do it for that at least for 3 to 4 months. If we look into the data, again, freezing noted in the standard cold boxes, though it was, look into that, the freezing, if you look below 0 degree, though it was 3.6% in phase 1, and it is 1% in 19 in the standard cold boxes during the phase 2, it was noted. There was a temperature excursion more than 10 degree also. It was noticed during both the phase 1 and the phase 2 also. The issues I'll come in the next slide. What the reasons could be probably the more frequent opening and other challenges were noted on that. Another challenge which was during the log tag placement was primarily that due to the incorrect placement of the log tags by the temperature loggers, because if you looked into the picture of the left trade, there's a 12 ice blocks in the side and 9 on the top. So if a log tag top was placed on the top, it used to capture the temperature from the ice packs. So there was a showing the freezing temperatures, though it was considered as an internal. So we had to again place the log tag on as per the standards. Then sometimes while taking out the ice blocks, health workers or cold chain managers take out the log tag from the cold boxes and put it in the freezer, or the freezer was kept it into the log tag. So there was a confusion regarding that. And log tags appears to have been removed prematurely from the cold boxes, sometimes during the vaccine storage or transportation, which led to insufficient length of the data collection on that. Like as I said that the phase 1 results, there was no freezing in freeze preventive cold boxes, but there was a high temperature excursions occurred. The phase 2 results, there's not a single incident of freezing in the freeze preventive cold boxes, whereas a 1% or 19 freezing temperatures were recorded in the standard cold boxes during the phase 2. Both the equipments experienced high temperature excursions, 1.7% in internal log tag readings and 4.7 were there in the bottom internal log tag readings. As compared to the standard cold boxes, 15% of the readings were above 10 degrees Celsius. This primarily, when as per the project methodology, we divided both into quantitative as well as the qualitative data. This is primarily on my last second slide on the qualitative feedback from the health workers, and Adam is here. Adam supported that in the analysis of that. Primarily, how the health cold chain managers or cold chain handlers perceive this device is it. Primarily, the ice packs partition in the cold box increased vaccine safety by reducing the risk of freezing. The partitions decrease or eliminate condensation. So they noted that condensation is not there. The vaccine boxes are not getting wet, or the vials are not getting wet. The labels are not going off. Frozen ice packs, it saved time in preparing the cold boxes. And more challenge was to transport the cold box, because it was one or two, at least 2 people was required to carry out transportation even from the district store till the vehicle, and because it's a heavy. And the storage volume appears less, because sometimes they ask if a campaign is there or some other requirement, it needs to more storage space will be required as compared to the standard cold boxes. Last slide. This is on the costing study, and I think, and it led by my colleague Mercy, who is a health economist and supported that. Primarily looking into the doses taken per shipment, and the costing was also done whether how much of percentage of vaccines will be saved or vaccines going into the freezing. So the doses taken per shipment, if we talk about an average of 4,000 to 7,000 or 8,000 doses were shipped during the transportation. And value of all vaccines, all calculations were done as per Nepal, the vaccines into the routine immunization schedule, and the pricing was done as per the current standards. So you can see that $2,739 to $5,500, and 65% of the vaccines is almost goes into the freeze sensitive vaccines which was taken during the shipment. Though the cost of, we say that freeze preventive vaccine carrier is higher, but one freezing incident can result in loss of vaccines that cost 5 times more than the price of the freeze preventive cold boxes. So this was primarily the path supported in collaboration with Ministry of Health in Nepal. We did the freeze preventive evaluation, and at last, thanks to MOH Nepal, the development partners, WHO, UNICEF, BMGF headquarters, BMGF India office, PATH team, and Left Trade for the support. And thank you so much for listening and for taking your time for this session. Thank you so much.
Can we have just one question, please? One question? Yeah. Due to time.
Thank you, Sandeep. Thank you for an excellent presentation and clearly laying out facts that are required. So I think this is a very clear evidence when we talk about cold boxes. And in the cold boxes, you have, in the graph that you showed across the temperature, it took around 3 hours for a freeze-free vaccine carrier to reach a temperature between 2 to 8 degrees or 2 to 10 degrees.
0 to 10 is.
0 to 10 degrees. So a 3 hours of cycle that is there. Now, considering 3 hours of cycle, there will be many places who do not even take 3 hours to reach the vaccines. So in those cases, I think, although it provides an advantage of preventing freezing, it also brings in a disadvantage where you are looking for the entire supply duration, the vaccine is out of that range. So how do we address that component? Because if we are introducing cold boxes for a short range, these will create excursions, especially on the temperature. So what's the feedback that you have from the study?
No, I think, thanks, Dr. Brigu. I think this was also monitored, where we monitored for both the freeze preventive vaccine carriers and the freeze preventive cold boxes, because it was taking long time, though it is as per the WHO PQS pre-qualification. But I think there's a still discussion going on whether it needs to be started for the cold boxes or the vaccine carriers needs to be prepared well in advance, so that before taking the transportation, so that the temperature comes to within the range. So there was a qualitative findings, and we have already shared that. So, but that's your point. That was a real challenge, because for the vaccine carriers, it becomes more prominent because during transportation to the health facility level, so that even before the session is over and the temperature is going below 0 degrees Celsius. So, but I think that still is in under discussion on that part.
One last time for Sandeep. So thank you all for coming. I think we've learned a lot about life cycle assessment, the use of cool water packs for shipments of vaccines for the prevention of freezing, as well as a field evaluation of freeze preventive cold boxes. For life cycle assessment, I think what we have learned is the knowledge we have is still very rudimentary. For us to be able to apply to daily program, we still need some learning to do, and also collecting additional data for this, right, Steve? And then for the use of cool water packs, we know that this is effective, but of course there's a challenge of how do you condition these packs to make sure that they actually prevent freezing. So maybe that's something we need to follow up with. And proof of concepts, the freeze preventive cold boxes are actually working in the field. So good news. One last time for everyone, and then bon appetit.